Ectopic pregnancy. These are pregnancies that occur in every other place apart from the uterus. In Kenya, the incidence of ectopic pregnancies is at 0.003% and accounts for a third of all abdominal surgeries in the Department of Gynecology at Kenyatta National Hospital. Welcome to Focus on Health, a show on all matters health, wellness and lifestyle. I am your host, Job Offender, and on this episode, we discuss ectopic pregnancy alongside Dr. Francis Were, an obstetrician and gynecologist and a member of the Kenyatta University Wellness Center. But before we dive in, take a look at the health updates. Very informative health updates right there. And like we said, we are discussing ectopic pregnancy alongside Dr. Francis Were. Daktari, kindly introduce yourself to our audience.
My name is Dr. Francis Were, as you've been told. I'm a consultant obstetrician gynecologist, cosmetic gynecologist as well, and a lecturer at the Department of Obstetrics and Gynecology, Kenyatta University.
Okay, so the topic of the day is ectopic pregnancy. What exactly is an ectopic pregnancy?
Okay, by definition, an ectopic pregnancy is any pregnancy that occurs outside the uterus, because you see the uterus is actually meant for carrying the pregnancy, but for some reasons that we are going to mention, sometimes we find the pregnancy occurring in parts outside the uterus, mainly in the fallopian tubes, in the abdomen, sometimes in the cervix, and even on the ovary.
Okay, so yes. The commonest site is the fallopian tube.
Yes.
And what is the reason for this?
The reason for that is that the fallopian tube is meant to be a pipe or a conduit that conveys the fertilized egg from the last part of the tube to the uterus. But if there are factors that can hinder that conveying of that fertilized egg to the uterus, then you end up with an ectopic pregnancy. So there are many risk factors. I don't know whether you want me to mention all of them or just a few of them. Well, in terms of the risk factors, we have high risk factors which can actually cause ectopic pregnancy. Among them, and the topmost of them, is actually when the tube gets inflamed, and the tube can get inflamed from infection. Factors such as endometriosis can also actually affect the tubes. Previous tubal surgeries, previous history of ectopic pregnancies, all those can all lead to ectopic pregnancies. There are other moderate risk factors, like smoking, infections actually in particularly sexually transmitted infections can also cause ectopic pregnancy, and the use of intrauterine devices for contraception. For instance, the use of copper intrauterine device, or even the medicated intrauterine device that people use for contraception. Smoking is also known to be a factor that can cause ectopic pregnancies. Then we have those the lower risk factors, like women who are aged above 35 years can also stand a chance of actually getting ectopic pregnancies. And then sometimes you find women who have abnormalities in their fallopian tubes by nature, by the way they were born, with very narrow tubes. Those women are also prone to develop ectopic pregnancies.
Okay, and there's this notion on social media that the constant use of emergency contraceptives is also linked to getting ectopic pregnancies. Is this true?
Well, it's not a myth, it's a fact actually. Actually, it's one of those moderate factors. Don't mention them so much. The use of emergency contraceptives, the emergency contraceptives do contain fairly high proportions of progesterone. And as you know, progesterone is a pregnancy hormone. And what does it do to the body? It actually relaxes the smooth muscles of the body, which actually the fallopian tube is made of, because the fallopian tube basically is made of smooth muscles in two layers, one longitudinal outer layer and the inner layer, which is like a ring sort of. So when these muscles are relaxed, then there's that delay in conveying the fertilized ovum or the blastocyst to the uterus, and therefore an ectopic pregnancy results.
Okay, and there was also this case that happened a long time ago where there was an abdominal pregnancy that formed a stone of a baby, and the woman was carrying it for a long period of time. Is it possible that it can cause adverse health effects to these individuals?
Yes, abdominal pregnancies per se, as we mentioned, is also one of those ectopic pregnancies. And how it comes about is when maybe one has an ectopic pregnancy in the outer part of the tube, or the what we call the fimbrial area, and then they have a tubal abortion, or the pregnancy falls off from the tube. Then it can actually attach itself onto the viscera or the intestines or any other organ that is richly supplied with blood, and then continue growing. But being in an area that is not meant for, usually most of the time you find that these pregnancies do not do very well, because they develop their own placenta, and you can imagine a placenta growing on the intestines. It's quite a problem, because when they start bleeding, it can actually result in mortality or death of that particular woman. So when these babies die in the abdomen because of various factors, then they undergo what's called calcification, or the formation of a stone, okay? They mummify and form a stone, and therefore just cause constant discomfort to these ladies.
And yes. How can one tell that I'm having an ectopic pregnancy and this is not a normal pregnancy?
Now, it is very difficult to self-diagnose an ectopic pregnancy, but some of the telltale signs that one could be having an abnormal pregnancy, an ectopic pregnancy for this matter, is first, there has to be a duration of missed periods, or what we call in medical terms amenorrhea. Most of the times is usually around from about 4 weeks, okay? So if at 4 weeks you realize that you have not seen your periods, and then you are getting those little episodes of bleeding on and off, that could be a sign. Another sign possibly is because if the pregnancy is growing in the fallopian tube, which is actually the wrong site for it to grow in, it actually causes stretching of the tube, and that in itself will actually give you some abdominal pain. And the pain is usually can be constant, or can be on and off, or can be that dull pain. It may actually affect the lower part of the abdomen or one side of the abdomen, maybe on the left side or on the right side, depending on where the ectopic pregnancy is growing. So, and you also realize that when one has an ectopic pregnancy, unlike the normal pregnancies where one gets the constitutional symptoms of nausea and vomiting, in ectopic pregnancy, the nausea may be not really there, and they really don't really feel pregnant, because a pregnant woman feels, proper body changes because of high levels of the pregnancy hormones. They have breast tenderness, they have facial changes, the appetite changes a little, especially in the first trimester. So an ectopic pregnancy may not classically present, and somebody says that I think I have an ectopic pregnancy. Most of the times, actually, they present with, some actually come to hospital with severe pain, some come to hospital in shock. They actually brought to hospital having collapsed maybe at home, or even in town by the roadside, and maybe a good Samaritan takes them to hospital. And when further evaluated, they are found to have an ectopic pregnancy.
Doctor, you've also mentioned bleeding on and off, and
Yes.
there's this notion that there's something called implantation bleeding.
Yes.
Could you clarify on what exactly implantation bleeding is, and so that you dispel the notion, so that people are not very concerned when they see implantation bleeding and think that it's their periods?
Well, implantation bleeding, first what happens is that before implantation takes place, the uterus has to be prepared to receive the fertilized egg, or what we call the blastocyst, the stage of it. Because when fertilization takes place, this particular egg now divides rapidly and grows very, very fast as it's actually propelled towards the uterus. So there's usually thickening of the lining of the inner part of the uterus in preparation to receive the pregnancy. So sometimes when the pregnancy is just about to be, implanted in the uterus, and usually it's about the third day after fertilization takes place, there's usually some little bleeding. It's more like spotting, and it just ends there. But where it goes on, persistently coming on and off for a number of days, then you'll definitely know that there is something which is not quite right.
Okay, and is there a natural cause for ectopic pregnancy where they resolve, or is it just it needs management immediately?
Yes, now ectopic pregnancy has three possible outcomes. Left alone, an ectopic pregnancy can rupture, and of course the rupture is usually quite dramatic. It results in loss of blood in the abdomen, and also the particular patient may actually have fainting episodes, may even actually collapse because of loss of blood. The other thing that can happen with an ectopic pregnancy is that it can actually be expelled from the tube, what we call a tubal abortion, and then extruded into the abdominal cavity. And then it may actually die, or it may end up growing as an abdominal pregnancy. And last but not least, it can actually resolve on its own. But again, those are very rare circumstances for an ectopic pregnancy to just, self-resolve. Yeah.
Okay, and also, can ectopic pregnancies, after a period of having an ectopic pregnancy, are you at risk of having another one and another one?
Yes, as you know, the risk factors that I mentioned earlier on always are in play, even if one has had an ectopic pregnancy on one tube. Let's say, for instance, one has an ectopic pregnancy on the right side, which is usually the commonest site because of the presence of the appendix in the close proximity to the right tube. The left tube can also get affected by the same factors that actually cause the ectopic pregnancy on the right side. So it is said that there's usually a 15% chance that once you've had an ectopic pregnancy, there's a high chance that you can actually develop another ectopic pregnancy on the contralateral side that is normal. Yes. Okay, and is it a cause of infertility? Yes, it can actually be a cause of infertility in the sense that, if there is an absence of the tube, then there is no passage for the egg or the sperm to actually cause that fertilization. So that can actually result in infertility. However, because of the advent of technology, that can be overcome through the use of in vitro fertilization, where the egg can be harvested from the lady's ovary and sperm donated by the partner, and then it's fertilized in the laboratory, and then the fertilized embryo or the embryo can then be implanted into the uterus that has been prepared to receive it.
We're taking a short commercial break, but do stay with us. We'll be right back. But before then, take a look at the Did You Know segment. Welcome back to Focus on Health. We are continuing the conversation on ectopic pregnancies alongside Dr. Francis Were. Take a look. Okay, so how are ectopic pregnancies managed?
Now, management of ectopic pregnancies are actually broadly classified into two. You can either have medical management or surgical management. So when we talk of medical management, we have to have a certain criteria that we follow before we decide that this lady can undergo medical management. And medical management simply means giving some medication or some injection to try and dissolve the ectopic pregnancy. And the commonest medication or drug that we use is called methotrexate injection, which is usually a single injection that's administered, and then the lady is followed up by serial ultrasounds to see whether the ectopic is resolving or not. But there has to be reasons why we use the medical management. That is, if the ectopic pregnancy is actually not ruptured and it is less than 3 centimeters and there's no heartbeat, okay? Because heartbeat actually clearly indicates presence of, of life. So in that situation, we actually exclude them from use of medical management. Surgical management is now where we operate on these ladies to get rid of that part that the ectopic pregnancy is growing on, particularly if it's in the fallopian tube. Then ectopic pregnancy tends to actually destroy the fallopian tube. If it is ruptured, for instance, then that particular tube has to be removed, and then this lady will be left with only one functional tube, which she can still use to get pregnant.
Okay, and Doctor, you've mentioned if there is no heartbeat. So what if there is a heartbeat?
Now, if there is a heartbeat, you cannot do medical management. It is not feasible. It doesn't work. In that situation, then you actually prepare this lady for surgical management. And surgical management basically is cutting off that tube that has the ectopic pregnancy. Remember, I also mentioned that you may have an ectopic pregnancy not only growing in the tube, but even on the ovary itself. And when you have an ectopic pregnancy growing in the ovary, then it actually covers part of the ovary, and that ovary has to be sacrificed. Also, situations where one has had a previous cesarean section, when the scar heals, it can heal with a little rent or a little niche, and that niche can act as an area where an ectopic pregnancy can grow. So that's what we call the scar ectopic pregnancy. They are not very common. They are rare, but they do happen. And when they are diagnosed, this lady has to go through surgery to remove that particular area that has that niche plus that ectopic pregnancy, and then repaired so that she can now be able to conceive again the normal way.
Okay, so still on the concept of heartbeat.
Yes.
Is it a method to preserve that life? Is that particular life viable, or it's not even for preservation of life?
Now, it is basically not, because I know what you're trying to drive at is that if there is a heartbeat, then there's viability, and therefore we should do nothing. But remember, an ectopic pregnancy is growing in the wrong place. That is outside the uterus. The uterus is physiologically meant for carrying the pregnancy to term or up to the time when the baby is born. So if this pregnancy, let's say somebody has an ectopic pregnancy and you find a heartbeat and you decide that you do not want to terminate that pregnancy, then you're actually risking the life of that lady, because that pregnancy will continue growing, it will stretch the tube will give way, and this lady will start bleeding, and that bleeding can actually lead to mortality if not arrested in good time. So if it's a viable pregnancy with a heartbeat in the uterus, yes, that can be allowed to continue growing. But a pregnancy, an ectopic pregnancy with a heartbeat outside the uterus, the only management that is possible is actually surgery to remove it, to preserve the life of this lady. Otherwise, she can easily die if the tube bursts and she bleeds a lot and goes into shock.
Okay.
If no proper intervention is done.
Okay. So there's a lot of politics surrounding abortion, and one of the common concepts brought along is ectopic pregnancies. Would you term the management, especially when there is there's a heartbeat, as abortion?
If there's a heartbeat and the pregnancy is in the uterus, or in utero as we call it in medical terms, then that you would actually call as an abortion, okay? But if there is a heartbeat and the pregnancy is in the wrong place, in the fallopian tube, on the ovary, or maybe even on the cervix, then that pregnancy is actually growing in the wrong place. And you as a physician, with all the training you've had, you're supposed to help that lady to live another day and be able to get a pregnancy in the right place and continue procreating and get more children. But if you say that now this pregnancy is viable but in the wrong place and you do not do anything, you will kill that lady. Yes, so you have to act as a professionally trained medical person with good judgment to treat this lady.
Okay.
Yes.
So you've also mentioned the use of methotrexate, and sometimes it is common knowledge that methotrexate inhibits folic metabolism.
Yes.
So how soon should a woman get pregnant after medical management of ectopic pregnancies?
Okay, once she's followed up using blood tests that are done to see whether the pregnancy hormone, the beta HCG levels are dropping or not, for a period of about 3 to 6 months, you have to ensure that there's complete resolution of that pregnancy before then she's allowed to conceive again. So I think after about 3 to 6 months, she should be ready to get another pregnancy.
Okay.
Yes.
And how can women intentionally prevent ectopic pregnancies?
Okay, now a good question. It's more of a social issue in prevention of ectopic pregnancy. And the common adage that I like using is that be a law-abiding citizen, but do not fall for raw deals. And I'm sure you know what I mean when I say raw deals. In other words, use protection if you have to have sexual intercourse, so that you do not get those infections that can actually affect your fallopian tube and result in some damage that would actually lead you to getting an ectopic pregnancy.
Okay. Are there any other methods, including maybe abstaining from the use of IUCDs?
In terms of contraceptives or
In terms of
other methods, yes. If you can abstain, well and good. But how many have the heart to abstain, especially our young colleagues? Not very many. So contraceptives are still good in terms of prevention of not unwanted but a pregnancy at the right time.
Okay.
Yes.
So with your experience, I think you're better off to tell us, what does the mental health of women who experience ectopic pregnancies look like?
Yes, when a woman experiences an ectopic pregnancy, this is an aspect of medicine that actually affects them physically and psychologically. Now, physically, of course, because when they're going for treatment, for instance, if they go for surgery is usually very traumatizing and affects them psychologically, and they feel that probably there is something wrong that they did. They have their regrets. It also affects their family unit, of course, directly and indirectly, and also their friends too. All right. So in terms of psychologically, they feel that they wonder, why me? Why not Joy? Why me? Maybe somebody else should also experience what I experienced. So this is where now psychological counseling comes in, that they be reassured that yes, this thing can happen to anybody, and that once they receive the right treatment, then they should be back to normal, and they should be able to conceive. Even if they get the ectopic pregnancy more than once, there's a chance using technology that they can actually get pregnant and even go forth and get a baby.
So, yeah. Dr. with your experience also, maybe our viewers have had ectopic pregnancy for the first time. How common is it?
Ectopic pregnancy is not very common. And there's one aspect that probably we also need to mention. Sometimes one gets pregnant both in the uterus and an ectopic pregnancy concurrently, what we call heterotopic pregnancy. And this is usually found out when the lady goes for an ultrasound and they find, well, there is a viable pregnancy in the uterus, but at the same time there is a pregnancy in the fallopian tube. And therefore, such a patient should be managed in a way that the pregnancy in the uterus is preserved, of course, with her consent, and then the ectopic pregnancy is actually sorted out surgically by actually removing that part of the fallopian tube that is bearing the ectopic pregnancy. So it's not very, very common, but I would say maybe in terms of percentage, you may find that about 5 to 10% of women get ectopic pregnancies due to those factors that we mentioned, from the use of contraceptives, those who have gone through maybe surgery, like those who go for tubal surgery. Sometimes when they heal, the tubes recanalize again, and then they end up with a pregnancy in the wrong place. Okay. Then of course the use of medicated intrauterine contraceptive devices like the likes of Mirena and so forth. Yeah.
Okay, so Dr. as we wind up, give us your parting shots in relation to ectopic pregnancies.
So what I would say in terms of ectopic pregnancy is that one needs to, first of all, take care of themselves. And when you get pregnant, please visit a health facility as soon as possible, especially in the first trimester, when, if at all, the pregnancy is in the wrong place. It can be easily diagnosed and managed appropriately. And also, try and take care of yourselves in terms of your sexual partners. Do not have too many sexual partners, and if you have to engage yourself, then protect yourself so that you don't get those infections that can actually predispose you to developing ectopic pregnancy.
Thank you for staying with us, and just as Dr. Francis Were has emphasized, abstain from raw deals. I have been your host, Joy Bofenda, and until next time, stay safe, stay healthy, and live with the Healthy You segment.